I'm now going to invite Secretary Kinsley to share more about the specifics of what North Carolina is doing to take this critical step. Secretary Kinsley?
Well, thank you, Governor, and thank you for your leadership on this important issue and continuing to invest in the health and well-being of North Carolinians. As the Governor said, we've had the privilege of traveling the state to hear from individuals at events where navigators are trying to get folks enrolled in Medicaid. And what often happens is people tell these stories that are heart-wrenching about living without health insurance for a decade. Tears fill their eyes, and while they're relieved and have peace of mind for they and their families to now have health insurance, they're still struggling with the burden of debt that they had from a cancer diagnosis or a procedure that they had just a few years prior. It's clear that by providing relief for medical debt, we give North Carolinians not just peace of mind, but truly a fresh start. It's important to recognize that the individual carries the burden of medical debt, even though as it ages, hospitals rarely collect more than 5%. Individuals continue to struggle to buy food or to pay rent for the roof over their heads, and also they're scared to go into a doctor's office. An individual could have as little as $100 of medical debt, and yet they wouldn't walk in to have that preventative checkup or to get that necessary care, which means that they're putting off the health and well-being that they need, and they almost always end up in an emergency department at a higher cost and sicker. Medical debt like food and transportation and other key social determinants of health are things that we have got to curb in this state. And this is an important way that we're doing it. North Carolina is approaching this in an innovative way at no additional cost to the state taxpayer. By leveraging federal funding, what we've done is we're applying to the federal government for enhanced payments through our Healthcare Access and Stabilization Program. This way we'll be sustaining this in the future. Hospitals, to qualify for these increased and enhanced payments, will have to do two things. They'll have to put in place relief for debt that dates back to January 1st of 2014. That was the first day by which we could have expanded Medicaid in North Carolina, specifically focused with income eligibility limits on low and middle income North Carolinians. And remember, hospitals are rarely going to collect much of that anyways. And then going forward, put in place charity care floors and put the onus on hospitals to ensure that people who are eligible for charity care programs actually get enrolled. This will not only provide relief for medical debt, but will help make sure that medical debt doesn't build up in the future. This is a win-win-win for North Carolina. It's a win for our hospitals to be able to get enhanced payments for more investments in their health care and their work. It's a win for individuals who will finally have the relief from this burden, and it is a win for the health and the economy of North Carolina to be able to clear this bad and rarely ever paid debt off the books. It's now my pleasure to invite from the American Cancer Society, John Broome.
Thank you so much, Secretary Kinsley. I'm John Broome. I'm the Government Relations Director for American Cancer Society Cancer Action Network. Please use our acronym ACSCAN, so I don't have to repeat that too many times. Moving on to a very serious subject of medical debt. In March of 2024, ACSCAN conducted a survey. We asked individuals with cancer and who had been cancer survivors, about their experience with medical debt. What we found was over half of the individuals surveyed have incurred debt in order to pay for cancer treatment, or expect to incur debt to pay for their cancer treatment. Over half of those individuals. That's a significant number. And, this kind of creates a cycle. You've got over half of survivors surveyed had their debts go to collections. So this is something that keeps going on and on once you kind of, hit the tip of the iceberg. So, nearly all of the individuals surveyed here, 98% of these individuals were covered by health insurance in one way or another. And so this just speaks to, you know, the need for an outside box solution. We need to really, you know, think of how to you know, leverage these federal dollars that are coming in. And ACS can, you know, applauds the administration, applauds DHHS for all the work they've done. And we are fully supportive of this initiative and look forward to being involved as much as we can. And I would love to introduce my friend, Dave Almeida.
Thank you, John. Good morning. My name is Dave Almeida. I'm the Government Affairs Director for the Leukemia and Lymphoma Society. And I'm going to start by saying thank you to Governor Cooper for addressing the crisis of medical debt in North Carolina. Today, Governor Cooper has made it clear that the status quo isn't good enough. As the governor said, medical debt is no-fault debt because no one chooses to become ill. So no one should have to choose between putting food on the table, paying the rent, putting the kids through college, or engaging in life-saving treatment. And yet, medical debt is one of the leading causes of personal bankruptcy. It's one of the leading reasons for delaying medical care. In polling that we've conducted, more than 4 in 10 patients made the decision to delay medical care because they did not want to go further into debt. Equally as alarming is the fact that 1 in 5 patients avoided going back to the same provider where they owed money out of fear of not being treated. Governor Cooper's initiative to relieve medical debt and prevent the sale of medical debt to debt collection agencies means giving patients the ability to focus on what's most important, which is their health, instead of worrying about when the debt collector is going to call again and demand payment. Preventing a patient's debt from being reported to credit reporting agencies means being able to buy a car or a house or even a dishwasher, anything that requires financing contingent upon a good credit score. But there's a very important component of what Governor Cooper is doing here today, and that is preventing people from getting into medical debt in the first place. Cancer treatment and medical debt are in many ways very similar. The earlier the intervention, the better the outcome. Healthcare providers, hospitals are on the first line of defense against medical debt because they are on the front lines of our healthcare system. They're the first point of contact for many patients with the system. By creating a process whereby people are automatically enrolled in charity care, provides payment for healthcare services, which renders medical debt dead in its tracks. So on behalf of blood cancer patients in North Carolina, I'll close again by saying thank you to Governor Cooper for not allowing the status quo to continue.
Thank you, Dave and John, and thank you, Secretary Kinsley, for your tireless work on this along with the staff. We'll be glad to take questions. Yes. Oh, sorry, I'll let Jordan run the show. Okay.
Can you explain, you just mentioned preventing the sale of medical debt to debt collectors. How can you do that as governor?
So this is an incentivized program for hospitals. They're going to get one level of payment through this HAS program through Medicaid, or they can put in all of these issues on medical debt and get a much higher amount of money. So this incentivizes the hospitals to put in these programs, that they won't do this, that they won't report it on their credit. This will help these patients that they see and will help going into the future. And this is a program that really, I think they're going to come out financially a lot better accepting this higher level of HAS money instead of continuing to go after people and not getting a whole lot of money. The old blood out of the turnip thing, I think, is very appropriate here. Secretary Kinsley, would you want to add to that?
Sure. So the State Directed Payments Program, which is a federal program operated by the Centers for Medicaid and Medicare, has in it contemplated in federal rule the requirements and availability for states to use those payment programs to incentivize certain policies to be in place. Many other states have requirements like connection to a health information exchange or investments in achieving certain population health metrics and holding back a percentage of the payment until those things are hit. North Carolina is innovating to put in place, and first in the country, a set of medical debt mitigation policies akin to some of those other policy requirements that other states have done. The Medicaid program is large and complex. We have a number of provider payment requirements and policies we put in place all the time. This is us leveraging this particular tool to achieve the outcomes of that federal program.
That's just a follow-up. Isn't there concern that this will incentivize people not to pay their medical debt, or that this will encourage hospitals to not control their costs?
We know that individuals that actually on hospitals controlling costs, I mean, this is an even more incentive for hospitals to control costs, because as they negotiate with insurers as far as what will be reimbursed, the piece of the puzzle that's often not negotiated is the patient responsibility. With hospitals knowing that for low and middle income North Carolinians, they're not going to be able to collect a certain amount, it puts more of an onus on hospitals to negotiate with that in mind, and they've got to cap in. That helps control prices. With regard to individuals not being able to pay or choosing not to, no individual goes into a hospital and says, sure, I'd like all the treatments at no charge. That's just not. People are going into the hospital to be referred into care because they're making life and death decisions. And we want to make sure that we can keep those life and death decisions at the forefront of their minds and not let them worry about the cost.
Governor and Secretary Kinsley, just to be clear, this is specifically for Medicare and Medicaid patients only, or is it open to all insurance?
This will be for all individuals across any type of insurance. And the reason why that's important is because, a little bit perhaps to Laura's question, is we didn't want to incentivize folks to be on one type of insurance or another. And so we wanted to make sure that was smooth across the different programs. And again, consistent with the federal program that puts policies in place that are blind to what type of insurance.
Next question. Gary?
This is multi-part, but not too hard. How many people are currently enrolled in expansion? I saw it was 479 as of recently. Do you have another?
It's 498,000. We're almost there. And remember, this 600,000 projection was to be over 2 years. And so we're talking about having almost 500,000 in less than 8 months.
Kody, when was the request turned in, submitted?
We submitted the request last week, and we have been working closely with the Centers for Medicaid and Medicare to provide technical assistance on shaping this request, and we'll work with them to expeditiously go through the approval process.
I'm sorry, forgive me. The last question is about the hospitals. Again, it's telling that there's no representative hospitals here. What has been their reaction, and what is your general sense of how they feel about this?
Well, I'm confident that right now the hospitals are looking very closely at the details of the program, including the implementation time periods, to understand, what it would take to do this. We've been working collaboratively with the hospitals. We've had a lot of feedback from them. In fact, the policy that we're putting forward is very much a representation of their perspectives and the things that they think that they can do. We look forward to working with them to get this in place as soon as possible. It's the right thing for North Carolina, and again, it's a huge win for them, as the governor outlined.
Can you expand more on what those conversations with the hospitals have looked like? And like you said, it feels like they're responsive. Is that what you're saying?
I talk to the hospital CEOs, a number of hospitals every single day. I am so grateful for them and the work that they do to support the health and well-being of their communities. It's clear this is giving them another tool where they can provide access to a sustainable source of funding from the federal government, and in turn be able to use that tool to provide the relief to the people that they serve, and to get credit for doing it. It's a great win for them. I know that there's a lot of difference across our 99 hospitals that participate in this program. They're all going to think really hard about how they'll approach it, and we hope that they'll all say yes.
Does it seem like at least some of them are going to come to the table? Does it seem like at least some of them are going to come to the table?
We've had a lot of positive feedback right out of the gate on this, and we continue to provide technical assistance and insight into how this program will work.
Last question on here, Dan.
Some people with old debt have already had it turned over to collectors. Are they going to benefit from this, or is that debt already something they have?
We went for over a decade without Medicaid expansion, and I think about story after story after story of individuals that had to wait for insurance. This is the right time for us to move forward. It's always the right time for us to move forward. We've worked where we can to try to be able to provide relief for things that have been turned over to collections, to tackle liens, but we won't be able to go back in time on all things.
That's the time we've got.
Thank you, guys. Good job.